Hello everyone. Today we are going to discuss about the inequalities in the Aboriginal and Torres Strait Islander people. Aboriginal Torres Strait Islander people live in different parts of Australia, speak different language and belong to different culture. The health of the people living in urban area is different from those living in remote areas, depending upon the area and the environment and the accessibility of the healthcare services. And based on the 2011 census, there are more than 700,000 indigenous people living in Australia and accounting for 3% of total Australian population. If we talk about the history, then many indigenous army men served for Australia in Second World War, and it was in 1962 when indigenous people were given right to vote. In 1967, they were included in national census in national referendum. Firstly, the physical and the social conditions in which the person lives directly influence the health. It really does in case of indigenous people because they're still facing results of European colonization, specifically new infections and chronic diseases such as kidney disease, heart failure, and the cancer. And they live in a low socioeconomic status, low education level, lower employment levels, and subsequently there is a difference in the indigenous and non-indigenous Australians, and that is termed as gap. The difference is in the terms of economic status and the health aspects and the disease conditions and in the life expectancy. The average number of years that Aboriginal Torres Strait Islander male and female live was estimated to be 69.1 and 73.7 years respectively. It is 10.6 years lower than the non-indigenous in case of male and 9.5 years lower in case of females. The government of Australia is taking various steps to decrease this gap and to remove inequalities in health among Indigenous and non Indigenous Australians. So now we are talking about the strategies which are taken by the government to reduce this gap. The first is the Aboriginal maternal and infant health strategy that was implemented in New South Wales. It comes in 2001 for the improvement of Aboriginal pregnant and to decrease the infant mortality and morbidity. The strategy included the target antenatal postnatal programs for Aboriginal women and infants, a statewide training and a sport program for midwives and Aboriginal health workers who provided these services. Then an evaluation of the program. Then guiding principles of the strategy is a broad and social view of the health. Health was taken as a broad view, not just the physical fitness. Effective partnership with women and Aboriginal community, and it includes the partnership of women and the community people also. And the community healthcare care services were made accessible to all, and they were treated with cultural respect and competence. And community development was implemented, and then women-centered maternity care was provided. It includes the care to babies and 8 weeks postpartum care. Then, according to the evaluation done in the New South Wales, it has been found that there has been decrease in the births to women aged less than 20, and proportion of women attending for their first antenatal care visit before 20 weeks gestation increased significantly, and the women who reported smoking in the second half of their pregnancy decreased, and there is a perinatal mortality rate decrease. And one more study which was known as the Guraga study, which was performed in the urban hospitals. This is basically a study which was done on the women who were delivering in the urban hospital, and it collects the information on health development and the services used by the study participants at 6-month interval. According to this study, there is a requirement of change in the way service providers think. It influenced the public health service response to close the gap on Aboriginal disadvantage and influence the design to reorient child and family welfare services, establish the Bulandedi Gudaga program with ongoing funding. The study also suggests that there is a need for the other Aboriginal health services in Australia to publish their health service attendance pattern with the view to influencing policymakers to consider increasing targeted program funding to Aboriginal health services. Such funding could feasibly address the needs identified by patterns of presentation or for enhanced support services in Aboriginal health services. The Australian government of all states and council of Australia together agreed to close the gap by meeting at six targets that should be completed with a particular time in 2008, and that is known as the close the gap. In close the gap, the health was taken as a whole holistic view, not just the absence of the pathogens and the absence of clinical illness or the failure of body functions, but it was taken as a holistic, which includes the social behavioral determinants of health and as well as the performance of the health system. The determinants which included in this are the socioeconomic factors, which includes the education, employment, income, and home ownership, and then behavior pattern, which includes the smoking, lifestyle, eating habits, physical activity, exercise, breastfeeding. Then environment factor, which includes the housing, overcrowding, passive smoking, and others. The many determinants, they are directly and indirectly associated with the relative poverty and the levels of income. Then another aspect of close the gap between indigenous and non-indigenous Australian is the recognition that conditions experienced before birth and the during infancy childhood have the critical consequences on health throughout the person's life. Then close the target targets for indigenous disadvantages. There were six targets. The first of that is close the gap in the life expectancy within the generation by 2031. Then decrease the gap by half in mortality rates for indigenous children under the 5 within the decade by that is 2018. And then ensure that all indigenous children aged 4 in remote communities should have access to early childhood education within the 5 years, that is by 2013. And then reduce the gap by half in reading, writing, and numeracy achievements for indigenous students within the decade. Then decrease the gap by half in indigenous people aged 20 to 24 in years 12 or equivalent in attainment rates by 2020. Then decrease the gap by half in employment outcomes between indigenous and non-indigenous Australians within the decade, that is by 2018. And in May 2014 there was more target added to this close the gap, that is the school attendance within the 5 years of age of children. And it has been found by the study that the indigenous people were 7 times more likely as non-indigenous people to have received the child protection services because they have more prone to the home domestic violence and the other psychological stress due to their home environment. Then the Council of Australian Government made the National Early Childhood Strategy in July 2009 to ensure the education to the children and made accessible to all. And one of the key reform priorities in this strategy is to build a better information and a solid evidence based. This was formed in 1 January 2012. Under this framework, a range of key requirements including staff, qualification levels, educator to child ratio, and being phased into between 2012 to 2020. The goal under this agreement is universal access to early childhood education for children in the year before full-time school. And in April 2013, they reaffirmed its commitment to universal access to quality early childhood education by endorsing a new partnership agreement on universal access to early childhood education at the end of 2014. And this agreement supports the close the gap targets through the establishment of 38 children and family centers across Australia by June 2014. And the centers will deliver integrated services including early childhood childcare and support program services. Its aim was to provide the early childhood services to the education because it has been thought that the education which the child receives in the early childhood influence his adult behavior and the way the person behaves and the lives in his adult life. And if we examine the strategies, that what are the actions that needed to be taken to improve the strategies and to remove the inequalities in health, the first is there should be indigenous communities, families, and individuals taken greater responsibility for addressing the causes and consequences of disadvantage within their control. And the private sector organization and businesses improve access to their goods and services and improve employment opportunities for Aboriginal Torres Strait Islander people, and service providers and local territory state governments should involve indigenous communities and people as a partner in the design, development, and delivery and evaluation of policies, programs, and services. And there is a need that the government and the service providers, they should deliver their program services in a way that is driven by local indigenous people and strengthen local communities, and makes links with the corporate sector and draws on the resources within the community to achieve target targets. And the policy makers and the service providers, government, they should build the skill base of Aboriginal Torres Strait Islander people so that they are able to sustain the infrastructure and deliver the services in the communities. And then if we take in the health aspects, it is to the possible action that need to be taken is to ensure that public health program address known the health risk factors and environmental factors, and to develop the uniform healthcare standards and addressing the scope of services, provide staff levels appropriate staff levels and accommodation, facilitate patient transport, and these are the services that need to be taken to improve the healthcare sectors. Thank you. Thanks a lot.